In this video, we explore a virus that has been taking lives worldwide for over 40 years. To this day, there is still no definitive cure. Or is there? This is a look at 10 essential facts about HIV and AIDS. The story of HIV begins in Africa, but it first gained global attention in the United States during the 1980s. At that time, a mysterious disease began spreading among a specific group of people, primarily young bisexual and homosexual men. These individuals, otherwise healthy, suddenly began experiencing severe immune system failures. This led to opportunistic infections and ultimately death. Opportunistic infections are caused by pathogens that are usually harmless to individuals with healthy immune systems, but can become fatal for those with weakened immunity. This condition later became known as acquired immunodeficiency syndrome, or AIDS, caused by the human immunodeficiency virus, HIV. Initially, a person is infected with HIV, which can remain dormant for years before developing into AIDS, when the immune system is too compromised to fight off diseases. The first officially recorded AIDS cases appeared in the early 1980s. In 1981, 5 young gay men in Los Angeles were diagnosed with a rare form of pneumonia, later recognized as an opportunistic infection related to AIDS. Around the same time, other patients were diagnosed with an aggressive cancer known as Kaposi's sarcoma, also linked to the condition. These cases signaled the beginning of the AIDS epidemic. For a while, a Canadian flight attendant named Gaetan Dugas was believed to be the first person to bring HIV to the United States. He reportedly had over 2,500 sexual partners and was traced by researchers mapping the virus's spread. However, later studies disproved this theory. Dugas was not the first U.S. patient, but did play a role in the virus's transmission due to his numerous contacts. By the end of 1981, more than 270 cases of severe immune deficiency had been reported among gay men in the U.S., with over 120 deaths. Initially, the disease was dubbed GRID, gay-related immune deficiency, until it became clear that it was affecting other populations as well, including hemophiliacs, heterosexuals, and immigrants from Haiti. The name was then changed to AIDS. One reason HIV spread rapidly in gay communities is biological. During anal intercourse, small tears can occur, increasing the risk of blood exposure and infection. Additionally, gay and bisexual men tend to have more sexual partners than heterosexual men, which accelerates transmission. At the time, some labeled the virus as a gay plague, and religious extremists saw it as divine punishment. But soon, HIV began affecting people of all sexual orientations across the globe. So where did HIV come from? It's believed to have originated in Africa, first in monkeys, then in chimpanzees, which were infected after eating monkeys. Humans, in turn, contracted the virus from chimpanzees, likely during hunting or butchering when infected blood entered open wounds. Scientists estimate this first cross-species transmission happened in the early 20th century. Until the mid-1990s, an HIV diagnosis was essentially a death sentence. But the development of antiretroviral therapy in the late 1990s dramatically changed the outlook. These medications slow the virus's progression and allow HIV-positive individuals to live long, healthy lives. With consistent treatment, they can even have unprotected sex without transmitting the virus to their partners. In the Soviet Union, HIV arrived around the same time as in the US, despite the country's strict isolation and persecution of LGBTQ individuals. African students and Soviet sailors returning from Africa were the primary vectors of transmission. The first confirmed patient in the USSR was a military translator who contracted HIV in Tanzania and later spread it to other soldiers. Attempts were made to conceal this information, but by 1991, the man had died of AIDS. In the early years, the Soviet health system lacked sufficient testing capabilities. Blood samples from multiple patients were often mixed and tested together to save resources, reducing the likelihood of detecting the virus and facilitating its spread. Homosexual activity being criminalized also meant fewer sexual contacts, so in the USSR, HIV spread primarily through intravenous drug use. Addicts would often share needles, leading to mass infections. Soviet propaganda initially claimed the virus couldn't spread in the USSR, insisting it was a disease of prostitutes, drug users, and homosexuals, groups the authorities claimed didn't exist within the country. This denial delayed effective public health responses. Testing required documentation and lacked confidentiality. Patients were added to lists and had to report all recent sexual partners. The stigma was intense. Doctors and nurses often refused to treat HIV-positive patients. Neighbors ostracized those known to have HIV, demanding their isolation. In modern Russia, nonprofit organizations have tried to distribute clean needles and condoms to vulnerable populations, but officials have cracked down on such initiatives, arguing they encourage immoral behavior. Russia now has one of the highest HIV infection rates globally. Over 1.1 million people have been officially diagnosed, though the actual number is likely higher due to underreporting. Conspiracy theories about HIV still circulate, especially in post-Soviet countries. Some deny its existence altogether, while others claim it doesn't cause AIDS. These beliefs often stem from mistrust of medicine, low education, and a desire to feel part of an informed minority. Some even argue that antiretroviral drugs are harmful and profit-driven scams by pharmaceutical companies. This form of denialism, known as HIV dissidence, dates back to the 1980s, when a few fringe scientists questioned the virus's link to AIDS. Though thoroughly debunked, these ideas still spread online. In forums and social media groups, infected individuals encourage each other to reject treatment, often resulting in death. As members die, they are silently replaced by new believers. Some HIV-positive parents refuse treatment for their children, leading to tragic consequences. In one case in Russia, a 3-year-old girl died of AIDS after her mother ignored medical advice. In other countries, people have been prosecuted for knowingly infecting others. One notable case was Thabo Mbeki, the former president of South Africa, who denied the HIV-AIDS connection. His stance delayed the rollout of antiretroviral drugs, worsening the epidemic in his country. So why is there still no vaccine for HIV? Despite decades of research and over 200 vaccine trials, none have proven effective. HIV mutates at an extraordinary rate, far faster than most viruses. This makes it hard for the immune system or a vaccine to target it reliably. There is, however, one highly effective method of prevention: PrEP, or pre-exposure prophylaxis. Taken in pill form, it can almost entirely prevent HIV infection for a limited time. But it's expensive and only available in wealthier countries. Curing HIV is another challenge. While most patients cannot be cured, there have been 5 documented cases of complete remission. The first was the Berlin patient, who was treated for leukemia with a bone marrow transplant from a donor with a rare genetic mutation that makes cells resistant to HIV. He remained HIV-free until his death from cancer years later. Africa remains the region hardest hit by the epidemic, due not only to poverty, but also to misinformation, cultural practices, and lack of education. In some regions, female genital mutilation and dry sex practices contribute to HIV transmission. Many people distrust medical professionals and rely on traditional healers instead. Some even believe that HIV can be cured by sleeping with a virgin, a myth that has led to the sexual abuse of young girls. Fear of stigma also prevents many from seeking medical help. During the Cold War, HIV became a tool of political propaganda. The Soviet Union launched Operation Infection, aiming to convince the world that the US created HIV as a biological weapon. These claims were first published in a pro-Soviet Indian newspaper and later picked up by other media outlets globally. Even though top Soviet scientists rejected the idea, the KGB continued spreading the narrative, contributing to modern-day HIV conspiracies. Misinformation from that era has had lasting consequences, especially in places where access to education and healthcare remains limited. While the world has made significant progress in fighting HIV, the virus still thrives where stigma, poverty, and ignorance prevail.